Well, good evening. I am Dr. William Pavelitz, one of VOCO's North America clinical educators, and this evening, cracking the dental code ceiling, the 2024 edition. I want to wish everybody thanks for coming in, and hopefully for the next 50 minutes, we can be sharing some information between ourselves. Q&A is available at the end to answer any questions or comments. Um, a little disclosure, the content of tonight's presentation is based on the opinions of myself, but they've been reinforced by colleagues that have helped me along the way. I've been doing this for more than 6 years now, and they really help in regards to getting the information to clinical educators like yourself. Um, I am an employee of VOCO America, where they are commercial support for tonight's CE program with Viva Learning. So I wanted to let all of the attendees know that. Who am I? Well, I am a graduate of Temple Dental School back in 1991. Things changed after my residency and my prosto training, and I shifted my career. I ended up with VOCO America, been with VOCO for 19 plus years. My contact information right there, email and text. Question may come up. Please use that QR code and share your thoughts or questions or concerns that you may have in regards to the information that I'm going to present this evening. So let's get started. We're going to be talking about, as our patients would say, insurance, but they're dental benefits. And that's the way we have to really express that with our patient pool. It's not as if your car accident, your car is going to get replaced. We have a certain dollar amount that is yearly to be used on their dental treatment. And we have to actually let them know that in regards to the dental benefit. I got to give a big shout out and thanks to Kathy Forbes. She is one of those colleagues that I had mentioned in regards to sharing her information on billing. She is the guru. Questions. We have tonight 50 minutes to talk about several different products and how to correctly reimburse for that. We're not going to get through everything, but she is your go-to person, or you can easily email me or text me with my contact information, because what she did when I got involved with the lecturing circuit, I wanted to bring some added value to my attendees. And after speaking with my company and trying to figure out how we can bring something like added value to the dental community, we came up with this document. It is a 13-page document. It doesn't pertain specifically to a VOCO product, but it pertains to dental procedures that a hygienist, an EFTA, a dentist would do on a day-to-day basis. And I'm going to actually be referring to this document throughout the evening. But if you want, scan that. That automatically gives you a PDF. And it is something that you want to share with your dental team or your front desk or whoever is handling your dental benefits, to actually make sure that you are getting reimbursed for those procedures or those products that you're using in-house. So with that said, move January 1st, 2024. One of the biggest changes that we've seen is a new claim form. And, we're now January 16th. If you're not aware of this, if you're still using forms from the past, 2023, 22, they are not valid. Make sure that you talk to your dental benefit carriers and make sure that you are using the correct form. As some of the statements I'm going to make in regards to some of the procedures, some of the CDT codes that we're going to talk about. If you use the wrong code with the wrong procedure, or even document it incorrectly, many times and a lot of times it is going to be rejected. So the biggest change was this January 1st, where the new documentation took place. And it's interesting because this document, and as I'm speaking about some of the procedures, there's going to be a lot of crossover between dental and even medical, where you're able to build the medical benefit carrier for some procedures that you're doing in the office. So please be aware of that. Here, a biggest change was the locum tenens. And this is box 53A on this new form. It allows providers to actually know who is working in a dental office. We are coming off of, COVID, and still it's with us, but, there are some shortages within the dental community between your hygienist or maybe other dentists. And it actually helps indicate the treating dentist acting in the confines or ability of the office where they're working. And it actually helps, assist with the accreditation and the claims for some adjunct products or procedures. They're also looking at some other ancillary claims or treatment information. Here, interesting, the last scaling and root planing done on the patient. That's box 39A, where it allows that date of service for the last scaling and root planing to actually be documented. And that documentation, as I proceed with the tonight's course, we're going to be talking about some of the other tools that we use within our day-to-day practice. So this enables an inclusion of data to help expedite the claims for reimbursement. We also see this payer ID, box 3A, which also helps give the benefit carrier, whether or not it's dental or medical, because we see this crossover. The ability to put it in that payer ID for the supplemental on any of the benefit plans might be even from a third-party payer. So this is providing a lot of the information that can really expedite and make the claim process work rather quickly with our claims that we're doing. And again, the payer ID or the supplemental, where it's crossing over with, our provider in regards to assisting the right route for the claim. Now, I know this evening we have 50 minutes to talk about this. What I would encourage as a dental team, the dentist, if you have your huddles in the beginning of the week, talk to your hygienist, talk to your EFTAs and the front desk, and make sure that they are aware of these changes in regards to this format. What it breaks down to is really, and I use the ADA here, they have a new claim form. And again, if you're an ADA member, it's free to the offices, where you can get it either electronic or handwritten if you're using that submission. But using the right printed claim forms to be submitted, it helps and it stops any types of delay that your office or your patient would get in regards to reimbursement. So please be aware of that. I know it was a lot to take in, but familiarize yourself with this new claim form and make sure that your dental team is aware of it. Because interesting enough, here, the beginning of 2024, we saw 16 new or amended procedure codes. For tonight, I like to give the sneak peek to our hygienists. Interesting enough, we have a procedure very similar to a caries arrested medicament. This is code D2991. And if you haven't heard of these products, they're a topical application of a hydroxyapatite that actually is applied early on when the dentist or the hygienist sees the early onset of caries, very similar to the silverdimine. And if you haven't seen or heard of this product, the Curodont product, this is actually that hydroxyapatite that is done on an application. Interesting enough, so we're January 16th and trying to find certain fees and what is the reimbursement. Much of my lecture is based on Delta Dental. You know, they're very out forward in regards to information that they give. And, you know, something like this medicament, Curodont, you know, the 2991, it's per tooth. It's actually 2 applications per calendar year, but you also have to treat it like a caries arrested medicament. The fees vary. Kaiser Permanente, MetLife, Blue Cross Blue Shield. I would encourage your front billing person to actually reach out to those common benefit carriers that you deal with and find an average in regards to that fee schedule that we see. Another interesting change to the CDT was this immunization counseling. It's quite important where the interaction for our patients, it is between the dentist and the patient, but many times the first contact person is either an assistant or a hygienist. And that hygienist who is doing his or her procedures, whether it's pocket depth and prophy and scaling, it's the interaction between that patient and advising them about the importance of the immunization. Pretty much, I think COVID really made a big change with this. You know, they look at some of the statistics. You know, the role of the dental hygienist is 91% in regards to that interaction for talking about the administration of certain vaccines and sharing it with the doctor. Interesting, when I reached out to Delta Dental, they're claiming that this benefit is not covered under most of the dental plans. They didn't say all of them, but under most of them. And it is a responsibility of the patient. So again, this complete medical history, this assessment of our patients, this is for their benefit. And many times we have to educate the patient on the benefit of these immunization shots. So definitely take a look into that. So we're going to start with these billing issues and why we look at the challenges that occurs with a lot of it. What's covered? Are you using the right product? Who's covered? Age is a big factor when it comes to fluoridation. We see a trend where many offices are actually offering fluoridation treatments to all of their patients. But many times that patient would reject that treatment because many times their dental benefits don't cover it. But we know the benefit of it. Using the right code. If you're not updating the coding in your billing system, you're using old codes that fall under foams and rinses, that's another way that many of the dental benefit carriers will reject a claim. We know the purpose, the CDT coding. Why do we have it? I'm based in Philadelphia. I can be talking to a doctor on the West Coast. We can mention a code and we can still talk the same language. It gives us uniformity. It gives us consistency by the dentist, the hygienist, by the EFTA. And, as Kathy and Patty DeGangi, she was my mentor on dental codology. Even though they would say, hey, Dr. Bill, there's a code for this, but it doesn't necessarily mean it's covered under the policy. And I said, well, that's kind of like an oxymoron. Why would we give a code? And I gave an example. New codes came out. Delta Dental just stated to us that the D1301 is not covered under most of their plans. Well, why not? It's how those plans are negotiated with either that small dental office or that DSO. But yet without a code, no coverage can actually be offered. We have to document what we're doing in the office. If I'm using a desensitizing code or a tooth cream, being able to talk to that person at Kaiser Permanente or Blue Cross or Blue Shield, they have to have some kind of documentation of exactly what procedure was done in my office. So I ask the audience, what tools are you using? Are you using everything available? And a lot of times offices, they forget about caries assessment. This caries risk assessment, whether it's Canberra or the one from the ADA, it is quite important to actually document why your hygienist is recommending a tooth cream or doing a lot of desensitizing, or maybe doing caries arrestment medicament on the teeth. It allows that carrier to understand what level of risk our patient is at. So I encourage, if you're not using it, you should incorporate that back into your practice, because it's actually an easy way to show your patient and explain to the patient the level or risk that they're putting their dental well-being at. Good dental assessment. Yes, good medical or dental history, radiographs, charting, it's all important. But it comes down to, a lot of times, the products. I mentioned the Curodont product. That's a regenerated nanohydroxyapatite. Really fancy words, but they've been in dental products for many years now. And it's picking the right solution for our patients. And whether it's varnish or desensitizing, even Gluma, the return on investment, the cost for Gluma is over almost $300 for a dental practice to purchase. Yet when you bill for it, the return on that is generally anywhere between $5 and $7. Okay, but we're going to talk about some other desensitizing procedures that actually have a return on investment 3 to 5 times higher. And the products are actually a lower price point. And again, some audience members would say, wow, Dr. Bill, you're really tying into this ability of using dollar amounts to coding. And it can be challenging for many of us to do that. But in a short period of time, I see some questions, Q&A coming up, and we're talking about digital printing and stuff like that. This course is normally 3 to 5 hours. So we're going to touch upon some of the highlights with the new. And what I would encourage you to do is actually reach out to your dental representative or dental provider and open up a conversation on the correct way of billing it. Because many times, look what we can offer. Treatment of root surface caries, fluoride releasing restorations, glass ionomers, resin reinforced, indirect restorations. There's a variety of procedures that a hygienist and doctor can offer the patient. And starting with a lot of the basics. coming down to something that I think a lot of us forget about. I had my own personal experience with some sensitivity issues over the last week on a tooth. And I could have sworn that they were going to show me an x-ray with decay, and it wasn't there. It was, some tooth erosion. And if you're using Gluma or a light cure desensitizer, this is actually ground zero in regards to correctly billing for sensitivity issues. The coding for desensitizing changed, and as I mentioned, nano filled desensitizers, nanohydroxyapatite, the Curodont product, they're finding from the research that this material significantly reduces the stimulus that really causes a lot of sensitivity issues in our office. And for that doctor who's spending $300 for Gluma or maybe Seal and Protect, are you getting reimbursed for it? And interesting enough, and please, you can, Admira Protect is a light cure desensitizer. And this is where the code changed a couple years ago from 9910 or D9910 to D9911. The ability for a hygienist or an EFTA or a doctor to place a light cure desensitizer on a cervical or root exposure per tooth. And the product is maybe $105. But the value of reimbursement in regards to desensitizing is quite phenomenal when you see that for Gluma, they would get a reimbursement of $5. A light cure desensitizer will actually get reimbursement of anywhere between $15 and $35 per tooth. And when we see a patient who has those issues with sensitivity, this is something that can actually be done with any type of product by GC America, Seal and Protect, even a bonding agent. Think about it, utilizing a bonding agent as a desensitizer. Well, it may have a self-etcher in there. Do I want to incorporate acid with that procedure? It dissipates rather quickly. Or we can go to some of these products that actually work rather well quickly and last probably up to 24 months in the patient's oral cavity. So again, knowing that there's two resin-based 9911 for that cervical or root application, or something as simple as 1999, which is an unspecific preventative procedure, you probably won't see the return on value or reimbursement from that you would see from the 1911 in regards to desensitizing. Shifting. A lot of offices are relying on tooth creams. MI Paste Plus, ZenCP, again, something new to the market in regards to calcium phosphate desensitizing gel, very similar like the Remin Pro, nanohydroxyapatite. All great for, 13 reasons, from patients who are vaping, from water sources, bottled water that is as acidic as some sodas are. Mouth rinses, interesting enough, have different pH levels that can cause sensitivity issues. Ortho patients, medically compromised patients, medications that dry out the mouth, help stimulate saliva. We're looking at topical tooth creams. How is the office using it? Is the patient medically compromised? You may want to take a look at even the billing issues. Are they willing to spend $15, $20, $25 for a 30-day supply of a tooth cream? Something that can actually help combat their sensitivity issues. And it's simple procedures by your hygienist, by the doctor, analyzing the saliva sample, collecting it. Are we able to show our dental benefit carriers the reason why we are suggesting a tooth cream? And it's all of that combined with the caries assessment. Here, Delta Dental, we talk about, capturing how much salivary flow was there. Was it stimulated? Was it unstimulated? Simple task of putting a cotton roll in a patient's mouth and collecting a sample for a minute. Interesting enough, if they're looking at billable procedure here, they're looking at one assessment every 3 years. Hopefully, we're seeing some improvement with our patient, but we're putting them on a regimen of that tooth cream, an application of a desensitizing medicament. That would be perfect. Or using the true coding benefit of the 9630 of a drug or medicament actually dispensed chairside to show the patient the application and allow them to go home with it. And this past year, 2023, we saw the introduction of a fluoride gel carrier using a code 5986 with making very similar to a night guard and allowing the patient to apply this tooth cream on a daily basis at night where it's most effective to combat a lot of the sensitivity issues, the dry mouth, and actually help, strengthen the teeth from within. So something we have to consider. So whether it be Remin Pro by Voco or MI Paste, Zen CP, your choice of product, choose wisely. Many of the older products are milk-based. The newer products like Zen CP and Remin Pro are water-based. So you're able to have better coverage of patients that in the past, if there was any milk allergens, they don't have to worry about the milk peptides within in the tooth cream. And even some of the newer materials, they can brush with it. So understanding the right code with the right product truly helps. So, for somebody who is using a product that is a tooth cream to combat salivary, or maybe somebody's having medication with dry mouth, a fluoride gel carrier, 5986, easily suck down method in your back lab or send it to a lab, bill for it, and then use the correct code like 9630 in regards to a drug or a medicament dispensed chairside. Or you can actually bill 9910 for a general desensitizer. But if you're charging that patient $20, $25, the reimbursement with the last code, the 9910, the reimbursement is going to be anywhere between $5 to $7. So it's where using the right code with the right material can actually help. Shifting forward, and as you see, we're kind of building up with a lot of the building blocks that we use every day in our dental practice. Most of it is coming right from a hygiene department or from the cubicle. And for doctors to say, listen, how profitable is my practice? We have looked at, 3 different products that can be quite effective. Now, we know the differences between the foams and the varnishes. Varnishes are much more effective in treating, dental caries, whether it be children or adults. It comes down to reimbursement. Many offices haven't updated those old codes, the 1203s, the 1204s, and they hear about patients who they're rejecting a claim for even a child under the age of 16. It's because they're not using the right code. If you're not aware of it, this occurred probably around 4 or 5 years ago, where they delineated between a fluoride rinse and varnish and a foam and a varnish. If you're using a topical application of a varnish, you should only be using 1206. Now, interesting enough, some people would say, well, wait a minute, you know what? I would prefer using a foam and a rinse. It's not that effective for our patient because you can use just a topical application at 1208. Many dental benefit carriers are reimbursing under $20 for that material. And as I'm hearing a lot of, prosthodontists, aesthetic offices offering fluoride treatment to their adult patients, maybe it's because of dental implants. We have to worry about non-acidulated and acidulated fluoride treatments. Do they have an acid level to them that can affect their mouth? And the answer is yes. And we have to find something that is neutral pH and very effective for them to actually continue their dental treatment or their dental well-being. Here we see that application with the correspondence of a caries assessment. And here's where things are changing. In the past, your billing department might say, I'm only going to submit for 1206. But if the hygienist did a caries assessment and that patient shows that they're a high risk, and they document it along with that coding, that 0603, it is giving Delta Dental or Kaiser Permanente, that staff member, an image of what that patient is at risk for and why. Many times we're seeing a shift where they are covering a fluoride treatment over the age of 21, but it's following certain guidelines for that assessment, that treatment, and documentation for that procedure. Because here we're getting into even our patients who are getting a fluoride treatment from a nurse practitioner, even a physician working in medical community health service, where they're sharing this ability of being treating medically and dental. And interesting enough, we're seeing that shift of application. They're submitting under their medical insurance benefits or their medical benefits under the code of 99188 for a topical application of a fluoride varnish. The reimbursement is around $20. Where we see this happening a lot is in medical community centers, in rural cities, I should say rural areas, large cities under certain Medicaid and Medicare plans that are being shared with the underprivileged areas. And in the past, it usually was for, 6 months to 2 years. And then they would have to go see a dentist for an evaluation. Interesting enough, within the community, Kathy Forbes and Patty DeGangi has shared that dental offices are actually using medical coverage for their adult fluoridation patients. And if you think about it, caries is a disease. And if you top that off with somebody who is recovering from a medical illness or going through some kind of treatment where the benefit of a fluoridation treatment can actually help their overall well-being, it's key. And when I talk to some of these offices, And many of them are Delta Dental, Kaiser Permanente on the West Coast. We're seeing no question about reimbursement for a tooth cream. I'm sorry, not for a tooth cream, but for a fluoridation treatment. And interesting enough, some of these offices are actually getting reimbursed $70, $80 for a fluoridation treatment on an adult over the age of 21. And it comes down to the remark box on that new form, sharing it with the medical and the dental, because it is a patient who is at medical risk. And documenting it, we don't have to write a book in regards to the progress notes, but keep it short and concise. We're all used to social media. It's like Twitter, going out there, using a small number of letters or words with that treatment. We're seeing the effectiveness of reimbursement on our adult patients. So something to actually look into. Many of the synthetics that, or I should say synthetic products that are being introduced, maybe your patients are allergic to a colophony-based varnish. There are other solutions. A liquid version of a varnish, something that doesn't have a colophony in it. Floramax is very similar to a product like Profluoride L from Voco. It doesn't use a colophony base to its delivery, but it's just as effective as a typical fluoride varnish treatment. How is that? It's because of the chemistry. We started this course or this lecture with talking about the changes of the product, nanohydroxyapatite, remineralization procedures, where now we're looking at different carriers using sodium fluoride and calcium fluoride salts. One is highly soluble, has a very short-term effect, but the other one is low soluble. It doesn't break down that quickly, and it definitely able to put the material into or transfer it within the dental tubules. And they're getting the same fluoridation benefit as we see with a fluoride varnish. It doesn't have a colophony base to it. We see also other avenues where it can be used. Liquid fluoride treatments are key when you're looking at somebody who may have sensitivity issues when there's deep root planing and scaling. Or you might even do whitening or external bleaching within your office. And interesting enough, and as Kathy formulated this this document, she kind of broke it down in different topics, or I should say, different approaches. Being the top one is the way to go with it. Here, she's looking at the bleaching of the material on a per arch. If you document that you did some kind of whitening, and that application for a desensitizing medicament is something that includes an in-office treatment for root sensitivity. So she's using a code 9910 for an application of a desensitizing medicament, charging for the arch, upper and lower, for the whitening, and then any desensitizing because of thermal sensitivity. And you have to really take a look at that remark box. Box 35 can actually be a game changer. I know that the new form actually has a drop-down box, but if you're doing it by hand, giving the certain remarks that you have experience with the patient can actually support the documentation of the treatment. Even to the point that these synthetic varnishes They're using 9911, like the light cured desensitizer that I mentioned, because they are resin based. So if that patient has cervical exposure or root exposure due to overzealous brushing, and the patient complains about sensitivity between hot and cold, we definitely have a procedural step that we can take with that per tooth. And with the application of 9911, unlike the code 2991 we talked about with the Curodont, which actually allows the office to apply the application twice on the same tooth within the calendar year, the dental benefit carrier will actually cover it. After the second application, it's the patient's responsibility. Here, 9911 is per tooth. So if it's somebody who has some quadrant exposure in regards to overzealous brushing or recession of the tissue, that's per tooth there, and that's per calendar year. But you're looking at a billing procedure of anywhere between $20 to $35 per tooth for that application of a dental product that takes the professional less than 3 minutes of their time and effort, but the results are immediate for our patients. So thinking of the synthetics, again, 9910, 9911, based on the application of that desensitizing medicament, can actually be your best choice of using that code. And I know people have been really shooting a lot of questions in regards to the Q&A. Insurance companies do offer 1208. Here was from Flo Goodman talking about it, but you apply a varnish. And, doctor, if you're using the wrong product, this is ideal, because as I finish the lecture, I talk about, we talk about fraud. We have to it is our responsibility to document what we're doing with the right product. If you're using 1208 as your example, but you're still using varnish, and if you ever get audited by a dental benefit carrier, and they see that all you've been using is varnish, but you've been billing out for a fluoride rinse or something other than a varnish, you can get into a lot of trouble. It's considered insurance fraud, because it's not the correct procedure with the correct code. You have to understand that the code and the procedure must go hand in hand. We're already almost 7:45, and just spending the last 10 minutes finishing up with sealant. Not a lot of changes, but they finally did give us the ability to bill for a sealant repair. Many of the sealants out on the market, when it's first applied, we're seeing even a shift with adult sealants being more popular. Understanding that ability to stop that carries risk from going any further or breaking down the tooth. Our two choices here are 1351 for a virgin application, or if you're doing any kind of repair, 1353. Simple in regards to the sealants, not much has changed. But as we start to wind down the evening, we're going to end with, our good old glass ionomers. And glass ionomers, whether it's reinforced or traditional glass ionomers, we're seeing an upswing of usage in dental offices. Are we billing correctly with them? And who's actually using these materials, because it's interesting how that's shifting. Whether it's the atraumatic restorative technique, and I mean that's been around, forever in regards to, our training to be able to go in there with the hand instrumentation and scoop out any of that decay, removing all of the soft material, leaving anything that's hard, and then plugging away a glass ionomer, or that interim therapeutic restoration with our pediatric patients. Both are quite helpful in regards to addressing carious lesions. Here, we actually see our other team members getting involved with it. Glass ionomer application, contouring, removing, it's changing. For our West Coast clientele, where we have restorative hygienists who there's no issue with a hygienist actually placing or contouring a glass ionomer. And it's shifting. There's 30 plus states that are allowing that to occur. And it's good for us. It gives us another set of hands to work with in our offices to address any of the patient's needs. So whether you're doing an ART or an ITR, just know the difference between the protective restoration. And this is not a material that's being used in root canal therapy as an interim therapeutic placement. That interim therapeutic restoration is actually for the primary dentition to maintain the spacing or that arch support until those permanent teeth are coming in there. Interesting enough, definitely there is that definition or delineation between the two. Just know that the 2941 is solely for our primary dentition or our primary placement with our adolescents. Now, the claim form, yes, I probably would have to eject this because that claim form is non-existing right now for 2024. They have the new one, but what this highlights is the remark box and also the diagnosing box. The ability to actually use diagnostic codes. And this is where we're seeing the shift with medical coverage, medical benefits covering it. Because on our form that everybody can take advantage of for free, Kathy Forbes actually talks about utilizing those diagnostic codes in a dental office. And going forward with it, again, to my colleague who was mentioning using a fluoride rinse, but then using a varnish, we want to make sure that we're using that material with the right procedure, because it comes down to being concise with providing that supplemental information. The reason why many, Patterson, Henry Schein, Benko, your dental dealers have your dental license on hand is because of the audits. Are they using the right products? And you can be randomly, for an office that constantly does a lot of 1208, it may send up red flags to a dental benefit carrier to say, wait a minute, are they actually using that much foam and rinse? But yet, if they don't see anything ordered in the last year or two, they would probably come back and ask more questions, or then somebody steps in and that's when a formal investigation will start with it, because that's where it comes down to. These simple mistakes, we think, hey, listen, it's just like using 1203 or 1204 from years past. That's not the case when we're looking at fraud, because look at some of the reasons why you can be charged with dental benefit fraud, billing for services that were not provided. Simply, you did not do a foam and a rinse, you did a varnish treatment. Higher level of treatment for services that were performed. Claim forms that are altered. Most of the material has been electronic, but, changing dates of service, simple things like that, that really we take for granted, thinking, well, no, we're doing the right service. But in all honesty, it doesn't comply with the rules and regulations of the material that we're doing. So again, using the proper code, getting your team members to know that, hey, listen, it's the person who's doing the billing. Her name is on that. His name is on that. Maybe it's the hygienist. And I've talked to certain dental professionals that said, listen, I left an office because that person wanted me to say I was doing something else. And it's my license. It's my reputation out there. So wrapping it up, it's a lot to take in. And I know some of the Q&A, they were asking for some digital coding and, just to go through some of, well, here, and Dr. Flo Goodman says, 9911 is mostly not covered. Yes and no. It's asking the benefit carrier, what guidelines are they looking for? What are they trying to achieve? And following that. I'm trying to look here. Well, Erica, a lot of the times I look at the hygienist, they're my right-hand person. It is practical and applicable in a lecture. And it's, as a hygienist, you're doing a lot of these procedures where there's a lot of added value that you're bringing into the practice. Many, offices say we need new patients. A lot of times we have our own patients within our patient pool, and they're being seen by the hygienist, and they're able to address that. And if you do hear somebody iPhone 7 need a history of a sealant on a tooth, again, it's documenting the application, whether it's been done at another office or they came in and you could see that it's broken, documenting it. Damon, 1208 for a topical fluoride varnish, not for rinse. 1208 is for foams and rinses. 1206 is strictly for varnish. So I have allotted all of my time. Let me go see if I have, and again, it's talking to, here I see 1208 and 1206. I know there's a lot of kind of combativeness between that. The dental companies are finally, or dental benefit carriers are finally realizing a varnish is more effective than a foam and a rinse. And it's asking how you do what you do with that material. Somebody's just asking, can we bill per quad? And in regards to that, you can bill, whether it be a varnish or a synthetic fluoride treatment per quad. You're using that same, that code, that 1206 for the varnish, definitely will be. But I appreciate, we had 868 plus people this evening. I know it's a lot to get into. Questions or answers, my QR code is there. Shoot me an email, shoot me a text. If you didn't get the coding document, I'd be happy to forward that to you and actually put you in contact with either a vocal representative or a dental carrier that covers the dental products there. I'm trying to see if there's anything else in regards to, Yeah, covering most of it. So I want to thank everybody for their attention this evening. I wish you all a great 2024. Please, a big thanks out to Viva Learning. They always give us the opportunity to be able to share some exciting products and some topics that usually aren't brought up over the years. But I want to thank everybody. Have yourself a great night. And we are finishing up with that. So have yourselves a good night. Thank you.